Hello listeners, welcome to Views on Health. As yet another Monday evening comes by, it's a great pleasure to have with me on the program tonight Dr.Suhashini Ratnatunga, consultant psychiatrist, National Hospital of Sri Lanka, and lecturer in psychiatry, Faculty of Medicine, University of Colombo. I'm sure you'll recall having heard Dr. Suhashini Ratnatunga over the series of programs in the recent past, addressing issues pertaining to psychiatry. Depression was one topic that the doctor discussed. And tonight on the program, it's recycling and management of stress. Now, stress is a bit of a buzzword, so to speak, not as in a buzzword, but everybody talks of stress. Children talk of being stressed out. And we wonder why children are saying these things. Adults, yes, I guess we can understand why adults keep saying it. And it just comes out very glibly out of one's mouth. I'm under tremendous stress. It's so stressful. I can't handle it. It's too much stress. It goes on like that. So the stress is a word that's very much in focus in our day-to-day lives. So, Doctor, I hope with that you can tell our listeners on recognizing and managing stress.
Thank you, Fatima, and thank you for having me again. I thought I'll just tell you an outline of what I intend to talk to you about today. First, I think it's important to recognize, we use this word very loosely, but to kind of recognize what stress really is. And then probably it might be interesting for our listeners to know, to recognize whether they are stressed and recognize the features of stress. And also there is this concept of whether stress is really bad. We all look at it in a negative way, but can we actually use it to our advantage? So is stress really bad, or is there something positive in it? And then probably if there is a side of stress that is bad, then probably we should tell our listeners how to manage our stress and how to deal with it. So if I'm to tell you what stress is, people have there are lots of definitions to stress. But probably one way of looking at it is we all recognize this feeling of being on edge, or finding it difficult to cope, or finding it difficult to handle things. And some may use the word anxiety for it, where we feel as if we are totally out of control, or we have lost control. And some people say that is being anxious. But if you're feeling very anxious, or where anxiety is excessive, then we would say that person is stressed. So it's important for us to first recognize that anxiety is a normal human emotion. We all feel anxious at different times, and feeling anxious is actually quite important, in the sense it's probably the body's way of telling us to probably act on something fast, or probably to be careful of something. If something is dangerous, then you need to watch out for it, and then therefore this cycle of anxiety is created in oneself, and then we probably take precautions, or we will act accordingly to protect ourselves from something dangerous. But when this anxiety goes beyond the necessary function it is supposed to serve, then we say that this person is having extreme anxiety, or maybe we could loosely use the term stressed. So we can feel stressed in different situations. All human beings experience stress, and there are certain things that cause stress for everybody. And there are some people who might think where certain things might not affect them, or they might not consider them as stressful. But certain natural disasters like floods, tsunamis can cause a stress for majority of people. Road traffic accidents, terrorist attacks, civil unrest. So these sorts of things can cause stress to the wider community. Then we talk of these events in our lives, which are called major life events, which can also cause stress to some people. So some people would consider the birth of a baby as a very happy event, But for some people, this can be a very stressful time. New mothers can feel stressed about, their role from being single to the transition to motherhood, then the demands that come with the new baby, having to feed the baby, look after the baby, get up in the middle of the night a couple of times. So probably if we start from there, so the birth of a baby or a newcomer coming to the family can be considered as quite a stressful event. Then marriage per se, so weddings and marriages are happy occasions, but for some people this can cause a certain degree of stress. Probably preparing for the marriage, then again your change in being single to a married person, your obligations, duties as a spouse, things like that can have an impact on your life, and this can cause a fair degree of stress. Then some people might think that graduation is again a very happy event, but then again that's another major life event. So you've now completed your education, you've got a certificate to prove that you've done really well, but then comes other demands. Okay, what sort of a job am I going to apply for? What are the jobs there in the market? Are they attractive jobs? Will I enjoy them? How far should I travel from home? How will I accommodate the rest of my life to this? So things like that. And then of course funerals, death of a person. Okay, so this can again cause a lot of stress, for a lot of grief to a lot of people. So what we actually discussed were major life events: birth, marriage, graduation, death. All these are what we consider major life events, which most of us will probably encounter at some point in our life. And even though we may view these as happy occasions, transitions in our life, a majority of people can consider them as stressful events, and these major life events can cause stress to some people. Then we talk of things called microstressors, or I like the word daily hassles, where small, they don't come as like a big chunk, like the way we described crises, catastrophes, or major life events. They come in small amounts, let's say. So if we take a home environment, we might have an irritating spouse, or we might have screaming children at home, or there might be domestic helpers who nag you about small things. We might have a difficult in-law living with us, or even the maintenance of a house, a bulb that doesn't work anymore, or a fridge that is packing up slowly. So all these things can cause tiny stressors, and over the years, over time, these can accumulate, and multiple of these microstressors can have an impact on a person's mental health. Then if we take the workplace, we might have deadlines we need to meet, or there might be expectations from your colleagues, there might be high expectations from your boss, which can again cause a lot of stress. Then there might be difficult colleagues who you don't get along with very well, or the work environment per se, the physical environment might not be very comfortable. You have a very comfortable here, a nice comfortable environment here, but most places might not be able to provide the good physical environment people would like to work at. So then if we take the outside environment, the traffic is in Colombo is going from bad to worse. So even road drivers, difficulties, road construction, all these can add up and can cause stress. Then we have what we call financial worries. There are probably loans you have taken, and then impending loans to pay, bills to pay. And of course, we have health worries. So as we age, when we are young, we don't think too much about our health. But as we age, we might have back problems, knee problems, things like that. And we need to look after our sugars, our blood pressures, eat less salt, eat less sugar. So all this, which are called microstressors, daily hassles, or minor stressors. But when minor stressors accumulate over time, or when a couple of microstressors get together, then this can have an impact on our mental health. So in summary, what I actually described was, I described what stress is. So we consider it as an extreme case of anxiety, or high levels of anxiety. We call it high levels of anxiety because anxiety per se is not bad, but when it is excessive and when it has been going on for some time, then we consider that as stress. There are three main domains, or people like to talk about when we talk about stressors or stressful events. The first stressor I talked about was which are major problems which cause stress to a majority of people, like crises, catastrophes, natural disasters, big events like that. Then we talked about major life events, the transitions we encounter in life, like birth, getting married, entering school, starting a new job, graduating from university, then the death of somebody. So all these are major life events which can again cause stress to some people. And we talked about microstressors, small stresses at the home, at the workplace, outside, financial stresses, small health worries, things like that. So basically I've summarized what stress is and what causes stress. So the three main stressors.
So actually, Doctor, listening to you, it was very detailed and lucid introduction to the topic of recognizing and management of stress. Everything in life is related to stress or brings about stress in some way to somebody. Everybody may not have the same impact, but it's there in some way and cannot be avoided. Before we proceed, may I just ask you about why children talk of stress? In your practice, you come across children, exams, yes. And maybe some children are so anxious about studying or not being able to study, or the marks they will get, or there's peer pressure. But otherwise, when children talk of stress, and we hear it, and it's wonder why are kids talking about it? Could you comment on that, please?
Yes. So when we talk about stress, managing stress encompasses what we called recognizing adaptive coping skills. So over time, coping skills is something we learn or we adapt by looking at other people, the way they cope with stress, and it's a trial and error method. So for children, they are still experiencing stress in their life, and it's basically a new experience for them. So for them, if they have a difficult teacher in school, at this point, you and I, Fatima, know how to deal with a difficult boss or a difficult colleague, but they haven't been exposed to it, and they don't know how to deal with this difficult teacher or a classmate who is bullying them. So for many reasons, because probably it's the first time they're experiencing that, or probably because of the lack of communication skills they have, things like that. So as you mature, you learn how to deal with stressful events. So I think we are all exposed to stress in different ways. Children are more vulnerable, I would say, because they don't know how to handle the situation, and they don't have the necessary tools to manage the stress properly. That they will learn with time and by observing mature adults, the way they handle stress. And as time goes on, their communication skills will improve, and they will learn to adapt to stressful situations by negotiating with somebody, or probably being more assertive, things like that. So I think the answer to your question is, for children, all experiences are very novel, and when it is a bad experience, they still haven't been equipped with the necessary tools or skills to deal with stress. So as time goes on, even when it comes to exams, they will know, okay, this is what happened to me in the past. I probably left it too late to study this particular topic. So probably this time I will have to study a bit earlier. I'll have to prepare for my exams earlier. or they will know what sort of things will make my teacher angry, so I better not say that, or I better not behave that way in order to not make my teacher angry. So basically avoiding stress, so letting stress go, get out of hand.
Thank you for that. And also, another, just a rider, don't you think that, as the professional, you're dealing with patients, and that parents also have a role to play in handling their children when they find that the child is going through some sort of stress or anxiety. I may say anxiety more than stress. They use the word stress, but anxious because of what is happening in school, or maybe even in the home, if there is sort of lack of harmony in the house, all that can impact on children.
Definitely. So children are very how do I say this? So children learn a lot from their parents. So there is a lot of modeling happening, and children will learn how to manage stress or how to deal with difficult situations by observing the way the father or the mother or a grandparent behaves. So if they see the mother shouting at the father when something goes wrong at home, then they will make that association. So when I'm upset, then I will shout at somebody, and then I will get my way, or I'll be able to resolve that situation. If they observe the father and mother discussing things and coming to an agreement or some consensus over a difficult issue, then the child will also learn that, okay, by talking about it or by expressing my emotions and by expressing my sharing my views, then probably that is a way of conflict resolution. Or if they observe their mother or father managing stress in other ways, like going for a walk or watching television or doing something busy in the house, then the child will also learn, okay, so as a timeout, I might kind of do something that I enjoy doing and distract myself temporarily from this stressful situation. So definitely parents have a huge role to play, and also it's important that that parents let their child express their anxiety, express their emotions freely to the parent, so that if the child is having a difficult time at school or a difficult day at school, the child is able to come home and tell the mother or father that this is what happened, and it was a bad day. So that this gives this is helpful in many ways. This is important for the parent to know what is actually happening at school and whether there is any bullying happening or something like that. And it also probably gets the parent involved, or opens the door for the child to express his self, and gets the child will value the parent's opinion. Otherwise, the child might not know how to react to a situation like this, and sometimes he might take a bad decision and might regret that later. So it's always good to have an adult or a senior's opinion with regards to things you're familiar with. So I think it's important for parents to let the child express themselves freely. It's not as easy as it sounds, but because parents are busy and there might be communication gaps between the child and the mother or father. But again, it's important that the child feels comfortable to come home and tell what's going on. And also always remember that your child is always observing you. He's looking at you, and the way he behaves or the way he reacts to stress will be quite similar to the way you react to stress.
Thank you, Doctor. Now, if you talk of recognizing, we've gone through this kind of seeing situations that can bring about stress, anxiety and stress. Management is another aspect which you're going to focus on. But when you say management, is it through medical advice, and would it be like a multi-pronged approach with the family being involved? If it's a child, or say the adults are concerned, maybe the adults involved. If it's a single person, okay, who else he or she is living with or working with? If it's a couple, then collectively, how do they approach the situation to, address it, and then ensure that who's stressed or if both are stressed, how do they overcome it?
Yes. So, like you said, yes, management is multi-pronged. We go on a case-by-case basis. Some very few patients will actually require pharmacological or management with drugs. A majority of the cases we try to manage by teaching them different coping styles, problem-focused coping styles, emotion-focused coping styles. And like you said, getting, if there is a problem in the marriage, then getting the couple down and then probably offering marital therapy or couples therapy to them. If there is domestic violence happening, then we might empower the woman to seek the necessary attention, necessary help from different authorities. If there is a stressed out A-level student, then we might talk to the student about managing exam stress and how structuring the day, and probably study techniques, teach him about different study techniques that he might find helpful. So we go on a case-by-case basis. But when stress is extreme and when anxiety levels are very high, for a short period, some psychiatrists might offer some sort of medication. So it depends on the type of stressor. It depends on for how long the person has been stressed, and it also depends on the type of stress or the quality of the anxiety. So if it is very high, then we might have not more options, but more things going on, more management strategies. We might employ more management strategies. But if it's a simple case of a student worried about an exam, then it's a bit more straightforward.
So you, as far as possible, like you said, you try not to prescribe any medication, but manage the situation without having to take anything. But would there come a time when you have to prescribe some medication? And if so, how does it happen? I mean, is it a long-term thing, or of course it's case by case again? One rule doesn't apply to everybody, but how does it work? And then patients do have this kind of fear about side effects of some of the drugs that are prescribed. Could you comment, please, doctor?
So when stress levels are very, very high, and if we have ruled out any other medical cause for this high level of anxiety, then we do prescribe medication on a short-term basis, maybe for a week or two. Let's say this person is having an important meeting coming up, or an important presentation for a job interview coming up. Then the other methods I talked about, like non-pharmacological or non-drug management techniques, usually these take some time to start working. So therefore, we might, in the interim period before we start those, or while they are ongoing, give a short course of medication. Some people are worried about the side effects, and I think that is it's correct to be worried, because most of the anti-stress or stress management pills we give belong to this class of drugs called benzodiazepines. There are of course other drugs that are used, but these are the ones that are commonly used. And if you continue to use them on a daily basis for maybe 1 month or more than a month or so, then they can become addictive. Which is why it's very important to tell the patient or the client that these drugs are they're good drugs. They work very well. They for most people, they help with stress levels. But if you continue to take them, then it can cause addiction and dependence. So therefore, so like I said, it's on a case by case basis, and if it is extremely necessary, then there is no harm in prescribing that sort of medication.
And is there a situation where you can say now this person has been treated and he or she is stress-free?
So it depends on what is happening in the patient's life. So if this patient has had an exam, and after the exam is over, then obviously the stress levels are zero. but then there might come another exam, and then this person will become stressed again for this exam. So what we do is we teach them techniques, coping strategies, in order to prevent further stress or future stress in a similar situation. So yes, once the stressor is removed for you and I again, once the stressor is removed, we might not feel stressed. But what is important is we have no control over these stressors. We don't know when there will be another wave of corona. We don't know we can't predict a road traffic accident. We can't predict domestic helpers going home. So stressors are something are things that we cannot predict. So the most important thing is to prepare yourself in order to reduce stress as much as possible by learning the correct techniques of stress management.
Thank you, Doctor. Well, time has caught up with us. So what's your take-home message?
Okay, so my take-home message is feeling anxious is normal. It's a normal human emotion. But if it has been going on for some time now, for a long time, and if you think that anxiety levels are high to a level that it's incapacitating you, and you have basically now lost control of things and you're unable to enjoy life anymore, then we would call that stress, and then it is probably time for us to look into it and do something about it. There are things that cause stress. We call these stressors, and there are common things which cause stress for a lot of people, and there are small things that can cause stress for some people, and these small things can accumulate over time and can cause stress for a majority of people. Not all stress is bad, but when stress is chronic, when it has been going on for some time at high levels, then it can be detrimental to your health. Therefore, it's important that we that you adapt good coping strategies, good coping skills in order to deal with stress effectively. As I said earlier, we have no control over what can cause stress, but if we have the tools with us to manage these stressors, then we can handle them more effectively.
Thank you so much to Dr. Suhashini Ratnatunga, consultant psychiatrist, National Hospital of Sri Lanka, and lecturer in psychiatry, Faculty of Medicine, University of Colombo, for sharing your expertise with us on this particular topic of recognizing and management of stress. And we sincerely hope our listeners who have tuned into the program tonight will take note of what has been imparted and try to cope with whatever stresses or anxieties you face in your day-to-day life, as well as assist those around you if you find them in similar situations. Thank you so much, Doctor. Truly appreciate your input.
Thank you.
It's been a pleasure listening to you, and my thanks go to Achala Gunasekara for technical assistance. I'm Fatima Razi Kharda saying good night, and hope to catch you next Monday same time on Views on Health.